First aid. Terminology. First aid is first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. It includes initial intervention in a serious condition prior to professional medical help being available, such as performing cardiopulmonary resuscitation (CRP), while CPR, while waiting for an ambulance, as well as the complete treatment of minor conditions such as applying a plaster to a cut. First aid is generally performed by someone with basic medical training. Mental health first aid is an extension of the concept of first aid to cover mental health, while psychological first aid is used as early treatment of people who are at risk for developing PTSD. There are many situations that may require first aid, and many countries have regulation or guidance which specifies a minimum level of first aid provision in certain circumstances. This can include specific training or equipment to be available in the workplace, such as an automatic external defibrillator. The provision of specialized first aid cover a public gathering or mandatory first aid training within schools. First aid, however, does not necessarily require any particular equipment or prior knowledge, and can involve improvisation with materials available at the time after by untrained people. Early history and warfare. Skills of what is now known as first aid have been recorded throughout history, especially in relation to warfare, where the care of both traumatic and medical cases is required in particularly large numbers. The bandaging of battle wounds is shown on classical Greek pottery from the 5000 BC, 500 BC, whilst the parable of the Good Samaritan includes references to binding or dressing wounds. There are numerous references to first aid performed within the Roman army with a system of first aid supported by surgeons, field ambulances, and hospitals. Roman legions had the specific role of capsari, who were responsible for first aid such as bandaging and other forearms of the modern combat medic. Future examples occur throughout history, still mostly related to battle, with examples such as the Night Hospitaller in the 11th century AD, providing UK to pilgrims and knights in the Holy Land. During the later 18th century, drowning as a cause of death was a major concern among the population. In 1767, a society for the preservation of life from accidents in water was started in Amsterdam, and in 1773, physician William Harris began publishing the power of artificial respiration as means of resuscitation of souls who appeared drowned. This led to the formation in 1774 of the Society for the Recovery of Persons apparently drowned. Later, the Royal Human Society, who did much to promote resuscitation. Napoleon's surgery Baron Dominique Jean Ray is credited with creating an ambulance corps, the ambulance volunteers, which included medical assistants tasked to admission, first aid in battle. In 1859, Jean Henry Dunant witnessed the aftermath of the Battle of Solferino, and his work led to the formation of the Red Cross, with a stated aim of aid to sick and wounded soldiers in the field. The Red Cross and Red Crescent are still the largest provider of first aid worldwide. In 1870, Prussian military surgeon Frederick von Bismarck introduced formalized first aid to the military and first coined the term Earth health, translating to first aid, including training for soldiers in the Franco-Prussian War on care of wounded comrades using prevalent bandaging and spilling skills, and making use of the Esmark bandage which he designed. The bandage was issued a standard to the Prussian combatants and also included 8 memory pictures showing common uses. In 1872, the Order St. John of Jerusalem in England changed its focus from hospice care and set out to start a system of practical medical help, starting with making a grant towards the establishment of the UK's first ambulance service. This was followed by creating its own village transport later in 1875, the St. John Ambulance, and in 1877 established the St. John Ambulance Association, the forerunner of modern-day St. John's Ambulance, to train men and women for the benefit of the sick and wounded. Also in the UK, Surgeon Major Peter Sheffer had seen the advantage of Von Esmer's new technique teaching of first aid and introduced an equivalent program for the British Army, and so being the first user of first aid for the injured in English, dissemination of information through a series of lectures. Following this in 1878, Shepard and Colonel Francis Duncan took advantage of the newly charitable focus of St. John and established the concept of teaching first aid skills to civilians. The first classes were conducted on the hall of the Presbyterian School and in Woolwich, near Woolwich Barracks, where Shepard was based, using a comprehensive first aid curriculum. First aid training began to spread through the British Empire through organizations such as St. John, often starting us in the UK, with high-risk activities such as ports and railways. Aims. The primary goal of first aid is to prevent death or serious injury from worsening. The key aims of first aid can be summarized with the acronym of the 3PC: preserve life, prevent future harm, promote recovery. Preserve life, the overriding aim of all medical care, which includes first aid, is to save lives and minimize the threat of death. First aid done correctly should help reduce the patient's level of pain and calm them down during the evaluation and treatment process. Prevent future harm. Prevention of future harm includes addressing both external factors, such as moving a patient away from any cause of harm, and applying first aid techniques to prevent worsening of the condition, such as applying prescription to stop blood becoming dangerous. Promote recovery. First aid also involves trying to start the recovery process from the illness to or injury, and in some cases might involve completing a treatment, such as in the case of applying a plaster to a small wound. It is important to note that first aid is not medical treatment and cannot be compared with what a trained medical professional provides. First aid involves making common sense decisions in the best interest of an injured person. Protocols such as ATLS, BATLS, SafePoint are based on the principle of defining the priorities and procedure where the correct execution of the individual steps achieves the required objective of saving human life. Basic points of these protocols include catastrophic bleeding, massive external bleeding, airway, clearing airways, breathing and ensuring respiration, circulation, internal bleeding, disability, neurological condition, environment, oral examination, environment. A major benefit of these protocols is that they require minimum resources, time and skills with a great degree of success in saving lives under conditions unfavorable for applying first aid. Airway clearing airways. If the patient responds in a normal voice, then the airway is patent. Airway obstruction can be particle of complete signals of a partially obstructed airway, including a change, voice, noise, breathing, agitator, and increased breathing effort. With a completely obstructed airway, there is no respiration despite great effort. Paradox respiration of or seesaw thing, a reduced level of consciousness is a common cause of airway obstruction. Particle complete a common single particle airway obstruction in the unconscious state is snoring. Untreated airway obstruction can rapidly lead to cardiac arrest. All health care professionals, regardless of the setting, can assess the airway as described and use a head tilt and chin lift maneuver to open the airway with the proper equipment section of the airways to remove obstruction. For example, blood or vomit is recommended. Breathing during respiration. In all settings, it is possible to determine the respiratory rate, inspect movements of the thoracic wall for some symmetry and use of auxiliary respiratory muscles and percus. The chest of for unilateral dullness of sonats. Cyanosis, distended neck veins, and lateralization of the trachea can be identified. If a stethoscope is available, lung auscultation should be performed and, if possible, a pulse oximeter should be applied. Tension pneumothorax must be relieved immediately by inserting cannula where the second intercostal space crosses the mid clavicular line. Needle thoracentesis. Bronchospasm should be treated with inhalations if breathing as insufflations. Assisted ventilation must be performed by giving breath with or without a barrier device. Trained personnel should use a back mask if available. Setting. Inspection of the skin gives clues to circulatory problems, color changes, sweating, and decreased level of consciousness are signals of decreased perfusion. If a stethoscope is available, here auscultation should be performed. Electrocardiography monitoring and blood pressure measurements should also be performed as soon as possible. Hypotension is an important adverse clinical signal. The effect of hypovolemia can be alleviated by placing the patient in the supine position and elevating the patient's legs. An intravenous access should be obtained as soon as possible, and saline should be infused. disability, the neurological condition, the level of consistence can be rapidly assessed using the AVPU method, where the patient is graded as alert, A, voice responsive, V, pain responsive, P, O, unresponsive, U. Alternative, the Glasgow Coma score can be used. Limb movements should be inspected to evaluate potential signals of lateralization. The best immediate treatment for patients with a primary cerebral condition is stabilization of the airway, bracing, and circulation, in particular when the patient is only pain responsive or unresponsive. Airway patients must be answered by placing the patients in the recover position and summoning personnel qualified to secure the airway. Ultimal intubation may be required. Pupillary light reflex should be evaluated and blood glucose measured. This decreased level of constituents due to low blood glucose can be corrected quickly with oral or infused glucose. Environment, overall examination environment, these signals of trauma, bleeding, skin reaction, rash, needle marks must be observed. Burning the dignity of the patient in mind, clothing should be removed to allow thorough physical examination to be performed. Body temperature can be estimated by feeling the skin or using a thermometer when available. Key skills. Certain skills are considered essential to the provision of first aid and thoughts ubiquitous usual, particularly the ABCs of first aid, which focus on critical five life-saving intervention must be rendered before treatment of less serious injuries. ABC stands for airway, bracing and circulation. The same mnemonic is used by emergency health professionals. Attention must first be brought to the airway to ensure it is clear obstruction shocking is a life-threatening emergency. Following evaluation of the airway first aid, attended will determine a decrease of bracing and provide rescues bracing in if necessary. Uh, Assessment of circulation is now not usually carried out for patients who are not breathing with first aiders. Now training to go straight to chest compression and thus providing artificial circulation, but pulse checks may be done on less serious patients. Some organizations add a fourth step of D4 deadly bleeding or defibrillation, while others consider this as part of the circulation step, simply referred as disability. Variations on techniques to evaluate and maintain the ABCD depend on the skill level of the first aider. Once the ABCs secured, first aiders can begin additional treatments or examination as required if they possess the proper training, such as measuring pupil dilation. Some organizations teach the some order of priority using the 3 BCs, breathing, bleeding, and bonus, or 4 BCs, breathing, bleeding, and bonus, and bonus. While the ABC and the 3 Bs are the thought to be performed sequentially. A certain condition may require the consideration of two-step simulation. Usually, this includes the provision of both artificial respiration and chest compression to someone who is not breathing and has no pulse, and the consideration of cervical spine injuries when inserting an open airways. The patient must have an open airway that is an unobstructed passage that allows air to travel from the open mouth or uncongested mouth down through the pharynx and into the lungs. Conscious people maintain their own airway automatically, but those who are unconscious with a GCS of less than 8 may be unable to do so, as a part of the brain the managed spontaneous breathing may not be functioning. Whether concern conscious or not, the patient may be placed in the recovery position, lying on their side. In addition to relaxing the patient, this can have the effect of cleaning the tongue from the pharynx. It also avoids the common cause of this and unconscious patient, which shocking or regurgitated stomach contents. The airway can also become blocked by a foreign object to dislodge the object and prevent shocking. The first aider may using techniques such as back slaps and abdominal thrusts. Once the airway has been opened, the first aider vault resists the patient's breathing. If there is not breathing or the patient is not breathing normally, agonal breathing, the first aider vault initiated CPR, which attempts to restart the patient's breathing by forcing air into the lungs. They may also manually massage the heart to promote blood flow around the body. If the shocking person is an infant, the procedure is to deliver 5 strong blows on the infant's back after placing the infant's face in the either forearm. If the infant is able to couch or cry, no breathing assistance should be given. Couching and crying indicate the airway is open and the foreign object will likely to come out from. Therefore, the couching or crying produces. A first responder should know how to use automatic external defibrillation (AED) in the case of a person having a sudden cardiac arrest. The cerebral rate of those who suffer cardiac arrest outside of the hospital is low. Permanent brain damage sets in after 5 minutes of no oxygen delivery, so rapid action on the part of the skier that is necessary. An AED is a device that can examine a heartbeat and produce electric shock to restart the uh, heart. First aid should be prepared to quickly deal with less several problems such as cuts, raises, or bone fracture. They may be able to completely resolve a situation if they have the proper training and equipment. For situations that are more several complex or dangerous, at first aid might need to do the best they can with the equipment they have and wait for an ambulance to arrive at the scene. Thank you for listening. Goodbye.